Hello, my name is Mary Galantino. Today I'm going to be presenting the nursing tutor, tutoring cycle, and the nursing process. Objectives for this presentation: we're going to learn about the tutoring cycle by McDonald. We're going to review the deliberative nursing process theory by Orlando. We're going to utilize both the nursing process and the tutoring cycle to approach tutoring in a systematic way. We're going to identify the 12 steps of the tutoring cycle as applied to tutoring techniques. And finally, we're going to understand the importance of establishing a learner-tutor-learner relationship similar to the patient-nurse relationship. A little bit of background information on the tutoring cycle. The tutoring cycle was developed in 2000 by Ross McDonald. It is a 12-step process which helps guide tutors through a session. It provides descriptive suggestions for assisting students during each step. There's also specific rationale for each step. The design of the cycle is a circular pattern. This enforces the concept that learning is cyclical. It is never ending, and one step builds upon the other. This depicts the tutoring cycle, all 12 steps. Throughout this presentation, we will discuss each step, what is to be done in each step, and the rationale for the actions which occur in each step. Let's talk about the nursing process, something you, the clinical RN, are a little bit more familiar with. Now, as you know, there are multiple theories around the nursing process. The one that we're going to focus on is the work in 1961 by Ida Jean Orlando. She was a psychiatric nurse who believed in the systematic approach needed to patient-centered care. Specifically, her work in psychiatric care made it essential that a collaborative relationship must exist between the patient and the nurse in order for any work to get done. The 5 sequential steps that she discusses in her deliberative nursing process theory are assessment, diagnosis, planning, implementation, and lastly, evaluation. This diagram is something I'm sure you are very familiar with. It outlines the 5 steps to the nursing process. We'll get back to this in a little bit. So why merge the nursing process and the tutoring cycle? And why have clinical nurses act as RNs? The answer is simple. Both of these processes, the nursing process and the tutoring cycle, are systematic approaches to tasks. They have defined steps with specific intentions. Critical thinking is necessary. Collaborative approach between participants is required. And finally, evaluation is essential for continued success. How are we going to merge the nursing process and the tutoring cycle? The next slide will show a visual representation of how the 12-step process will integrate with the 5-step nursing process. Essentially, the assessment phase of the nursing process will be similar to steps 1 and 2 of the tutoring cycle. The diagnosis phase, steps 3 and 4 of the tutoring cycle. Planning will be step 5 of the tutoring cycle. Implementation, step 6 of the tutoring cycle. And finally, the evaluation phase will encompass steps 7 through 12 of the tutoring cycle. This is a dual representation of the merging of both frameworks. The outside circle depicts the 12-step tutoring cycle by McDonald. The inside circle is a representation of the 5-step nursing process which Ida Jean Orlando proposed. As you can see, each step of the nursing process will specifically correlate to a step or steps in some case of the tutoring cycle. Let's start understanding a little bit about how the tutoring cycle and the nursing process will will work together, and how you, as the clinical RN, who already has a fundamental idea and understanding of the nursing process, can now integrate the tutoring cycle in providing an excellent learning experience for a student. Step 1, grading and climate setting. Now, while step 1, grading and climate setting, is not specifically associated with any step in the nursing process, you as the clinical RN know how important it is to establish a relationship with your patient. You have to be able to communicate with them in an open, honest fashion, especially if any of the interventions that you're going to implement are going to be successful. McDonald thought the same thing. He encourages tutors to greet the student and set the climate. Greet them by name, be friendly, and most of all, ensure that that student knows that you as the tutor want to be there. You also need to make sure you arrange a physical setting and set a positive, task-directed atmosphere. And finally, before the work begins, make sure to connect with that student on a personal level. 2, identification of task. This is most closely associated with the assessment phase of the nursing process. We all remember that the assessment phase is the data collection phase. This is when we, as the clinical RN, collect subjective and objective data. What does the tutor do, however, in step 2? Well, they simply ask questions. They ask the student, what do you want to work on today? Based on the student's response, this will be the goal of the session. Now, what happens if the learner's answer isn't specific enough? Well, you as the tutor need to make sure that you can gauge a question in a way that allows the student to pick a more specific topic to be covered. The learner has to choose one of the learning tasks which are mentioned. Step 3, break task into parts. This is known as the diagnosis stage in the nursing process. In the tutoring cycle, this step ensures that you can identify exactly what the learner needs help with. You can do this by having the learner set an agenda and an outline of how the session is going to run. You as the RN tutor, however, need to make sure you always have a backup plan. And if you don't think there'll be enough time, you need to prioritize which parts of the task need to be addressed first. By breaking the task into parts, this helps the learner create the opportunity to complete each individual step and thereby increasing their confidence along the way. Step 4, identification of underlying thought processes. This is known as the step in which specific kinds of work will have to be done in order to complete the task. Tutors should consult the text or lecture notes or other sources of information to reinforce that the learner can find concepts from class materials and not only from the tutor. 5, set the agenda for the session, planning phase. Be clear about what the learner needs to accomplish during the session. Have the student set the agenda. Actively involve the student. Have a backup plan in case the student's agenda is unrealistic and can't be completed in the time frame allotted. Remember to be flexible with the agenda and schedule the session accordingly. Allow the learner to allocate a certain amount of time for each learning task that needs to be addressed. And with little time remaining in the session, make sure you include the learner and ask them how they would like to use the remaining time. This helps foster independence as well as help promote time management skills. Step 6, addressing the task. This is the implementation phase of the nursing process. This is when the clinical RN implements and provides all the interventions that have been pre-planned. According to McDonald, this is the doing stage of the tutoring cycle. This is where the learning occurs. It's at this point that you as the tutor need to encourage the learner to address tasks without you being overly directional. You can appropriately respond to the learner, but make sure not to interrupt the learner's thinking. You want to show awareness, a concern, and an understanding of what the learner is saying without taking control. Step 7, student summary of content, evaluation phase. We all know in the nursing process that in order to determine if an intervention that we implemented was successful, we have to evaluate it somehow. We have to evaluate a patient's response to it, either a vital sign change or subjective data given by the patient. Step 7 allows the tutor to see the results of the efforts of the session. Once the task has been completed, the tutor needs to have the students summarize what they've learned. It's at this point that you need to ask open-ended questions about the content reviewed, especially if the learner doesn't even know where to begin or start. Try to refrain from using closed-ended questions. This can stall the session and really inhibit the learner from being able to discuss the process or the thinking behind the conclusions that they're drawing. After the learner's explanation, you as the tutor have the ability to discuss the accuracy of the information presented from the student. Step 8, summary of underlying process. Once again, this step reflects the evaluation step in the nursing process. Step 8 and Step 4 are very similar to each other in the fact that they help identify the thought process that the learner has utilized. It's during this step that the learner will explain to you how to do the type of tasks. Not simply completing or answering a problem that you've asked, but more importantly, making sure that the learner understands the content enough so that a completion of similar tasks independent from the learning session could occur. For instance, can the learner transfer the information learned from this session to understand other concepts? If this is indeed happening, then you can move on to step 9. If not, and you as the tutor is not convinced that the learner understands the process to which arriving at a conclusion, then McDonald suggests going back to step 7 and repeating. Step 9, confirmation. Again, part of the evaluation phase of the nursing process. Confirmation statements need to be made and need to be specific to the accomplishments. What does that mean? Well, you need to reinforce accomplishments and congratulate the learner on specific successes. Use sincere but sparing praise and encouragement. Be honest and specific with the feedback that you give. Remember, it's only through the feedback that the learner receives that growth and learning can occur. You want to encourage the learner to evaluate their own work and be proud of their accomplishments during that session. And finally, provide the learner with additional resources if they feel less confident or they still may be hesitant about certain topics and concepts. Step 10, what's next? Where do you go from here? What things will the learner continue to do that have been learned during this session? This is an opportunity to help the student anticipate what is coming next, and how the information provided during this session can be utilized, implemented, not only for future sessions, but for other concepts, problems, ideas. Step 11, arranging and planning the next session. This doesn't specifically relate to the nursing process, but it is very important for the tutor to take note of what occurs during this step. This step will allow the learner to make the decision whether or not to return for another session. I want you to know that as a new tutor, if a student decides to not return for another session, that's okay. And it may not necessarily have anything to do with you. It may not have anything to do with the information or how you present it. The learner may not understand what a benefit tutoring could be to them at this point. During this step, you want to encourage a revisit if you feel that that learner could benefit from additional learning sessions. You want to make sure to set a time and a place for the next session. And I can't stress this enough. Please try to keep your time commitment. I understand how hard it is to do anything outside of work and our daily lives. But for some of these students, they very much rely on the sessions that you're going to hold with them. Let's keep a commitment to them, just as we would expect them to keep a commitment to us. And finally, at this step, make sure to discuss what topics and concepts the learner would like to address during the next session. You could either go through concepts that weren't covered during this session, especially if you ran out of time, or you could take a look at a course's syllabus and see what's coming up next. This not only helps the learner prepare for the upcoming session, but you as the tutor may decide to make an activity based around the information that needs to be presented. You may need to brush up on some information, especially if you feel a little rusty in some areas of nursing. 12, closing and goodbye. Even though this isn't specifically part of the nursing process, you know as a clinical RN how important it is to end the relationship with a patient and on a positive note. You want to thank the learner in this case for their contributions to this session. You want to thank them for their time, and if they were attentive and prepared, acknowledge that. And always make sure to end the session on a positive note so that both you, the tutor, and the learner can walk away knowing that it was a successful and efficient session. Now that you understand the 12 steps of the tutoring cycle and the 5 steps of the nursing process and how both of these can integrate with each other, let's put together some final thoughts. There are so many benefits to the tutoring cycle and the nursing process, and especially when they're combined. First and foremost, both of these frameworks independently have been shown to be efficient and effective in completing a desired task. By combining the frameworks, it helps demystify the tutoring process, especially for a clinical RN who may be new to tutoring. Both frameworks also help reinforce practical approaches to learning. You as the clinical RN are in a unique position to help these nursing students. You do the clinical and the nursing part each and every day. What better person to help a nursing student apply context to content than you? Also, in your clinical work and in your clinical practice, you understand and utilize critical thinking. Nursing students have a difficulty understanding how to critically think. How do we teach a student to critically think? It's actually rather difficult, and no one has specifically nailed down the best way to teach it. But I know you, as the clinical RN, can help them better understand critical thinking, and how important it is to becoming a nurse. Finally, by utilizing both frameworks, you can help ensure an effective learning session. The reason is because both frameworks allow for structure, consistency, and once again, help guide you, the tutor, in the process. In order for an effective learning session, please remember to stay structured, stay consistent, and most importantly, come prepared. Come prepared and be present for that student. I thank you so much, and I am so looking forward to you succeeding as an RN tutor. You have no idea the impact that you will bring to these nursing students.